Let's Cover That podcast is brought to you by CM&F Group, professional liability services for over 200 healthcare professions. Visit our website at cmfgroup.com/podcast for more info.
Hey everybody, Will Sullivan here with another episode of Let's Cover That with my co-host,
Antonina Aguirre, and today we have with us Sara Gallo, a physician assistant and the founder of Clinical Insiders. Sara, thank you so much for joining us today.
Happy to be here.
Awesome. So let's just jump into it. Tell us about yourself and how you found yourself where you are today in your career.
Yeah, I definitely have always been, into, I guess, hacking things and also kind of understanding, the body and been interested in how to kind of optimize my own health. And so I went into healthcare really to learn, for myself, but also to help others, take care of themselves, be preventive. And I ended up in a primary care role for the last, I'd say about 10 years. And then after that, I felt like I had really hit being a primary care really well. I was very confident. I felt like I wanted another challenge. And throughout being a primary care provider, you end up actually doing a lot of hacking in that space. There's navigation that patients really aren't set up to do. It's really complex. And as you do it more often as a primary care provider and you see all the pieces that go together because you're the one who fits them all together for the patient, you really develop this whole nother way of just kind of knowing the ins and outs of how to get good care and where to avoid so that you don't end up in medical trauma. And so I wanted to actually do more and impact more than just one person at a time, and also saw the inequities and just inefficiencies in being a primary care provider. And I had been in the value-based care system for 5 years before I left. So I knew it was coming down the pipe. I did not like the way it was looking. It was really set up to be unsustainable for a primary care provider. And many times throughout, like even just when I was training and working with my colleagues, I just felt like we had so many good ideas, but we never had time to do anything about it and impact the future of our profession. And so I saw that they would just be, run down, feeling like their voice isn't at the table. And a lot of times it's like, well, then we need to be there. It's not something that's out of our scope. And certainly I think the reason why it's not in a good place and we're not thinking about how the patient navigates and what our providers need to do every day and how it fits into the way that we're modeling the care delivered, then we need more people up at the top. And that does mean sacrificing not seeing patients. But I worked with an executive coach, really felt very guilty and nervous to leave, like what I decided to do for the rest of my life, but felt empowered once I kind of really immersed myself into the space, went to the right spaces where there was the right mission, and felt empowered and uplifted to have my voice heard, and saw the impact that it could have just because we have a much more, I think, robust perspective on the patient experience and how it actually impacts the outcomes that patients have. So now I did spend a lot of time in like the innovation space, working with a nonprofit focused on safety net care and getting in startups to focus on, the Medicaid population underserved, and I like to call them resilient populations, and help them build models and develop their products to be more inclusive. And then I spent the last 3 years actually working at a telemedicine practice in Colorado that solely focuses on closing access to care gaps for the Medicaid population in Colorado, all throughout the state. So I was involved in really kind of transforming that practice, and had done that in my primary care practice right before I left when the pandemic hit, to do telemedicine, but not only that, but really integrate into traditional healthcare systems, which I think has been one of the things that I've been disappointed in the startup world, is that there's this really, really large hesitancy to serve a population that absolutely could be better off, and you could be the reason for it. I don't know any other privilege that would be better, because their care is below average. So anything above average will be immensely impactful. So now I kind of helped that practice get to where it needs to be, really connected it with large payers, the Medicaid managed care systems, the state, and got them involved in policy. And then I just want to keep repeating that for traditional healthcare systems, traditional healthcare practices, and also help to integrate digital innovations, startups that are really just mission driven to serve this population and get them to a place where they can thrive and ultimately not be discounted, to be honest, in practices.
So that's amazing, Sarah, and especially like your passion for, hey, let's go to an underserved population where like the access is a problem, the equity is a problem, and just making these changes make a meaningful, immediate impact. So just kind of circling back to one of your comments. So when you're saying resilient population, it seems like you're kind of bringing that kind of phrase to the forefront. Like what does that mean for us? And then run us through an example of like how the access to care digitally like makes an impact on that and the equity.
Yeah,
Just run us through that.
absolutely. So yeah, I think like, this mentality that we're doing good and these people need our help is kind of misrepresented. So, in particular, I would give an example of, a population that really doesn't get care designed for them. To bring to the forefront, let's say people who are currently using substances and are addicted. They are also homeless. They are also having food insecurity. They have financial insecurity, but they're living their lives. They're not dead. They're not dead. They're living. They're continuing to go. Many people could say they're surviving, but truly those people survive beyond the means that really we kind of see as being possible. And so I think they deserve actually a resilient kind of status. Yes, I don't think it's the best thing because, you don't want to be living in survival mode all the time and be on like death's doorstep. But those people still are, choosing to live every day. And to say that they're, I don't think that we should be labeling them other than that. And so one of the programs that I did in the telemedicine practice that I really feel very proud about was a maternal opioid misuse grant program. The state was actually trying to get funding to serve that population. And the design, I think, was a little more left open-minded and I could be really innovative. So what we had proposed was, as a telemedicine practice, we can be access to care. We actually don't just do telemedicine, but we actually train EMTs to be inside the community and then assist the visit. So they can do adjunct care along with see a provider. And so it really kind of stretches the vision of what telemedicine really could be. But you're seeing them in the place they feel safe. So the Harm Reduction Center, they do needle exchange, but they also have like a really strong peer community that are people with lived experience that aren't too far from what they, the people coming in and the people who are the peers are. And they trust anything that organization, brings under their umbrella. So we leverage that. And then I built the program around the peers so that they can use us. We can do what we need to do from a recommendation standpoint, but it's really just being an advocate, saying that the healthcare system is really like kind of there to support them, even though it really doesn't seem like it. And we will help you navigate to the right places, but the peer is the right person to do that. Let us just be, they'll be our voice. So you don't have to handle all the people that kind of come down on you once you are pregnant, once you are identified as a person, living with addiction, and feeling like that stigma is really being labeled on you rather than seeing you as a person who's looking to thrive, not survive. So I hope that explains it.
Yeah,
To an
I think
extent.
kind of what you're demonstrating is like, listen, there's the, you know, the dynamic of like survival, thriving, and you kind of have like a reorientation here of saying like, listen, these people aren't just surviving, they're actually like resilient because they're kind of up every day. They have like real obstacles in their life that they're trying to move forward with, and somebody just needs to get on a path with them and say, let me help you kind of walk through this instead of dictating it to them, and then kind of like delegating it out to them on their own almost. It's like a lonely place to be as you
Mhm.
navigate this. So I think that's like a really poignant way of kind of putting it.
I think it's
Yeah.
important to reframe the way that healthcare really needs to be delivered. A lot of the relationship that as a primary care I've been able to really develop and be successful at, improving outcomes and helping people actually advocate for themselves and their own health is by building that relationship, helping them learn to be a health advocate and a personal advocate. I think we're really great at being advocates for other people. And I will say the same thing for myself. Like, I was not advocating for myself as a primary care provider. I was advocating for my patients every day and not having anything left for myself at the end of the day. And I was like, well, this is a limiting scenario. I'm not going to stay in this forever if I keep trying to do the right thing. So let's maybe remodel the future to incentivize, providers really getting to do what they got to do. I understand and really absolutely want to leverage the value-based care model because I do think it incentivizes prevention. It incentivizes like a kind of really helping patients take care of themselves rather than being dictating and patriarchal. And so I do want to support that, but I do think that the way that they're designed is not leveraging the role of the provider appropriately. And I also think there's just a lot of waste. And if you think about all the reasons why things are the way they are, it's policy, it's, administration, contracting. It's not providers saying, oh, pay me for this because I think this is possible. It's not that they don't get to be in those rooms with us. And sometimes I feel like that's unfortunate because they really don't understand the value of what we provide and the secret sauce that we provide. And providers are so burnt out. I think we're really having a hard time actually speaking to that when we really need to, because we're just trying to keep our jobs. I mean, we're humans too. We're here to we also don't want to just survive. We want to thrive.
Yeah, for sure. And really, really amazing work, Sara. Can you tell us a little bit about the digital strategies that you're using to, open up access to care and treat your patients and, measure your success across the board?
Yeah. So I absolutely think most primary care providers, they don't realize they're part of a digital transformation already. One of the things that I like to focus on and how digital transformation can play a role into every single patient experience is also all the tools and the software and the kind of ancillary stuff that comes with going to your practice. So as a patient, you might be doing an intake. You have to wait, you get there, running behind. Now you have to fill out a piece of paper. Maybe that paper doesn't get to the provider. The provider doesn't even look at it. And so now we have so many other tools that really the not so bright and shiny and fancy objects, they are the ones that are making the experience better because they were so terrible before. And they're helping us leverage actually that collection of the data in more structured ways, so that they're going to be an easier and more efficient way to sift through that data once it comes through on our side as a provider, and make that time with that patient as influential and as holistic as possible, by, if we have a health related social needs screening, or a PHQ-9 that, checks for depression, it's already automatically given to the patient. So we don't have to spend time in that visit having them fill it out. And then we can actually go over it and it's entered in appropriately that we can actually track it over time. And then also refer them to the resources they need. So some of those things that, telemedicine can be very helpful. I think it's a modality to like meet patients where they are and be more, just more patient centric and convenient, because nobody wants health. I mean, whenever you need to access healthcare, it's never convenient. So, making it more convenient so it's not that extra barrier, like I don't have time, I don't have a car, I got to have somebody watch my kid, so that takes down those barriers. But then the other things are, let me sit in a mindful space where I'm not rushing, where I can answer the questions appropriately, that I have time to actually kind of consider. Maybe I need to ask about, the reason why I can't go to get my MRI is because they don't have transportation. I need to go to the dentist, but like they're booked out 3 months ahead, things like that you can actually throw in there. And then the team, which is great, can actually help with that patient's, resources. So if they identify, you haven't seen the dentist in over a year, let us get you set up with an appointment. Like, it is a pain in the butt. I've tried to call these practices for Medicaid access for primary care when we see them on telemedicine, and then try to migrate them to their local community health network. I've waited online on the phone myself through the physician line for, 5-10 minutes. Like, that's just unreasonable. So however we can kind of reduce the unnecessary burdens that really kind of stop people from continuing in that momentum of taking care of themselves. I think that's what digital transformation really is meant to do. And then it also really allows for that interoperability of health data. I get really frustrated when my patients would go to the ER, and I can see, through our health information exchange, that their chart in the hospital is completely just not correct. And, you ask a patient when they're having chest pains to tell the most, accurate medical history. That's just, I mean, honestly, don't ask me to do that when I go there. So I think there's ways to actually just transfer that information. I just print the note out and give that to the patient, so that a lot of times, maybe they're just, not really ready to communicate all this stuff, but I give them the information that they need, the clinicians, so that we can work as a team, even though I'm not there. So there's so many ways that we're doing it now that we just need to leverage. We need to, as clinicians, champion and advocate for, and also be part of the design of, because if we're part of the design, it's just going to be easier for us to actually integrate it and adopt it into the regular journey. But I think sometimes we're the ones in the way. And if we get more involved, we may not be as resistant. And then patients also really read that, and they're like very interested in supporting you. Like, patients don't get their diabetes foot exam, but if I asked, well, not foot exam, I'd say eye exam, I would just ask them to do it for me. And you know what? For some reason that works. Not saying that I have a magic touch, but I think anything that you can leverage just for them to be, in the best health they can be, is what our job is. And I fully support the digital transformation of practices so that we can do that more.
So what is, just kind of as like a kind of more of a closing leadership question for you, as PAs, how do you kind of present yourself? Like what are the things you would say to other PAs to say, hey, you have the opportunity to go from front lines to more like kind of in the tower, supporting how you scale out? Like, how do you employ yourself into the leadership position? Not just digital transformation, but just overall, like, you see what's going on in the front lines. There's going to be folks like you who can step into leadership roles and make a scalable impact. What do you say to them? And that's got to lead into like what's next for you and as things progress. So just, what do you say to people thinking about that? Like, I'm on the front lines, I'm doing all this volume, but I don't see the necessary change. How do I present myself in a place where is a place for me to kind of get here and make a change like you have? What does
Yeah.
that look like?
Yeah, I think first it's self-exploration to understand what's your mission. Plenty of PAs are happy to be on that one-on-one. I want to see the direct impact that I have on a patient. And I did really enjoy that. It was very rewarding, but so much of your role is not necessarily that. If we really look at it, they drive us to go to work every day, but there's, 1 or 2 scenarios, and then the rest, we might be just spinning our wheels and just waiting for that person to come around, which is totally fine. And I think we need to be accepting of the way that people want to treat their bodies, and just continue to be their advocates. But I do think that, if you see yourself already really stepping outside your traditional role of giving care and really wanting to be part of shaping how that practice or how that care or how patients really get involved in changing the healthcare system, or even just seeing opportunities and saying, I wish we could do this, I wish we could do that, and really walking yourself through, oh, well, I mean, we could easily just switch this part or make a template for this, then you're probably destined to do more. And, I do think that you have to really challenge the narrative. A lot of times, we have to be really honest with ourselves. We are the revenue for the entire system. So what real incentives are there for us to move out of that role? Very little. And our profession, I think, hasn't really built that pathway through education or just building awareness around what those pathways look like. So it's going to be a little bit of a lonely path where you feel like you're really getting people to think about things differently and see you as a leader and see you as somebody who needs to be given more FTE in a leadership role, driving some kind of quality improvement initiative, or being part of, the digital transformation efforts, or even just, practice transformation in general. And so ask for those roles. If you're doing it already, tell them you need time to do it. Don't just do it out of the goodness of your heart, and start to build that resume. And just because you didn't get that role, because I would say I wasn't ever really given that role in my primary care practice, but we were independent and we had 10 administrators versus like a hospital is like 32 a provider. So we all had to get involved, but I really heavily invested in supporting my practice to continue to have it be progressive and also understand the business of medicine. But I do think that it requires you going outside of your PA colleagues and really talking to either physician leaders, nurse informaticists that move up in systems, people who are maybe inspiring you to keep moving, and just reach out to them. We are looking to bring more people up into this space because more people there will just make it more normalized for us to ask and build pathways, and also build awareness around how PAs differentiate from other health professions, that they can bring something to an organization that maybe a physician or nurse practitioner or nurse can't do. I do think that we really are a universal multi-tool. We practice in all different specialties. We could have a resume that covers all specialties. So if you think of a primary care practice, if you did psychiatry and you did gastro and you did endo and you are now primary care, guess what? You are a multi-specialty practice in a person. And if you're trying to build an integrated practice or build a health system that incorporates that as a, kind of really just compacted patient experience, that's the person you should be involving, because they know how each of those different things interact with each other, and they have the knowledge of what the best practice could be and why it's not getting done today. So that's what I recommend is, PAs can be a tool just like other professions. And I do believe that we often can get exposed to more scut work, which is the stuff that really needs to be transformed anyways. So, as a physician, sometimes you are filtered information. You're not really shown the worst stuff because, again, like they're seen as the boss, right? But as the PA, there's not that same hierarchy. And so you do get asked to do those things. You are more down to earth and you get to hear the stories that your staff gets to tell you about what's wrong, or about what issues or what things that could be better, or what patients are really experiencing. And so I think that we bring a little bit of a different perspective that can be immensely valuable, especially to a startup organization or an innovation center that is really trying to do good work. But yeah, I would just say from like another thing is like equity should be in all of this. I look at digital transformation as an opportunity to build software that actually is designed to be inclusive, and can also meet patients where they are, but it does have a nuanced role. You have to think about who you're excluding. And most definitely, I would say, think of the mom who has a kid who is currently using, surviving out there, resilient as hell, is pregnant, has to interact with the healthcare system, but is afraid of losing everything and going to jail. Where is their healthcare? Where is their healthcare model? Where is the safe place that they can go where they don't feel like they're going to get everything taken away from them and there's really no purpose of living? We should have a way to enter and engage and be safe and feel like your clinician is your ally. They're not doing it because they want to break the rules. They're just in a really sticky situation. And a lot of times, if we really consider the social determinants of health of spaces, we don't necessarily prepare people for success. And I don't think that should be something that really destines you for a really sad life, an isolating life. So if we can do anything, I think designing for them where they need healthcare within 30 seconds of their decision making, otherwise they're going to dip, would actually be massively inclusive to everyone else.
Absolutely. And I think that's a super meaningful message, not just for healthcare providers across the board, but patients as well. So we really commend you on all the work that you're doing as a physician assistant, and as a digital expert in the field. And we would love to have you back on for another episode. Unfortunately, we have to wrap for today, but you're a wealth of knowledge and we'd be so thrilled to have you back.
I would love that. Thank you, guys.
Thank you so much, Sarah. And that's another episode. Let's cover that.